I'd want to share with you the best cardiovascular cures. So let's go through them all. Heart and circulatory difficulties. Give you an alternative right now just so you know. Anything I say is not intended to offend anyone. In place of your medical care check, consult with your doctor before applying any of this information. Having been said, the first topic we will discuss is the heart's fuel. The heart's fuel largely operates on glucose or the fatty acids, so the more the heart is damaged, the more difficult it is for the heart to access energy from glucose and fatty acids, which is why ketones may bypass that damage mechanism and feed the heart directly. Which is why I recommend you follow a ketogenic diet. Let's start with a clot. The medical treatment for a clot might be some medication like warfarin, which blocks vitamin K1 and so you don't clot as much, but there are some natural things that you should investigate. Number 1, something called nato kinase. So it's anti-thrombotic. So nato kinase is one therapy. And garlic has anti-clotting components. There are other natural remedies, but these are my 2 favorites. Now, with a plaque, the first thing you have is some type of injury to the vessel of the heart, usually due to excessive oxidation or inflammation. And then you have this chain reaction that occurs with the body making a band-aid out of cholesterol, calcium, and protein. Okay. So the best thing to do for clots is to do something that would have prevented the problem in the first place, which is a powerful antioxidant called tocotrienols. This is a type of vitamin E that I prefer over tocopherol because tocotrienols works like 50 times stronger than tocopherol, and so it's a really good antioxidant for the heart, especially. And it can also help you if you have angina because it allows the heart muscle. Calcium accumulation can be alleviated using vitamin K2 because K2 aids in the transport of calcium, the bone. Therefore, if you have an accumulation, calcium deposits in the incorrect areas, whether it's either the joint or the artery, vitamin K2 is essential. It also works in conjunction with vitamin D3. I'm not talking about vitamin C. I'm referring to the synthetic version, about eating a variety of meals. Vitamin C, often known as food-based vitamin C, is a nutrient, excellent antioxidant to preserve everything is fine inside the arteries. Let's talk about cholesterol. And not just cholesterol. I'm talking about a terrible lipid profile with elevated triglycerides. Maybe you have too much of the wrong type of LDL and your ratios are off. Niacin is an excellent treatment for all cholesterol issues. However, you should avoid non-flush niacin in favor of plain niacin. Niacin is a B3 vitamin that can help you balance out your cholesterol ratios and give you more HDL to LDL and so on. And niacin helps convert cholesterol to bile salts. And so this next cure called TUCA is a sort of bile salt that also helps transport cholesterol out of the body. Angina is a type of chest pain that can be caused by a clogged artery or a problem with the heart muscle itself. So I recommend tocotrienols as well as coenzyme Q10, which is a very powerful antioxidant for the mitochondria, especially for the heart. And when people take statin drugs like Lipitor, it depletes coenzyme Q10, which is essential for the heart muscle. As a result, those who have elevated cholesterol take statins. But what about the heart muscle itself? We need to help that coenzyme, right? Q10 is extremely beneficial to cardiac patients, deterioration in the elderly, only to give you a boost of energy for the heart muscle itself. And how it functions, excessive blood pressure within the mitochondria. Top 2 things that I am under pressure. High dosages are recommended for that. Potassium, because potassium is beneficial. Maintain the arteries, preventing elasticity, stiffness. If you have high homocysteine levels, you need more B vitamins, and just so you know, the primary reason why people have a B vitamin deficiency is because they eat too many refined grains and even sugar. So nutritional yeast is a very important thing to keep your homocysteine levels low. If someone does have cardiomegaly or a large heart, B12 is a really good antidote. If you possess blood pressure is too low, you most likely require additional sodium and sea salt. Or perhaps you require additional adrenal assistance. Arrhythmias that can occur anywhere, from atrial fibrillation to a single heartbeat, various arrhythmias to palpitations. Your electrolytes are depleted, and you require more magnesium, potassium.